5 NCLEX questions of the day. The following scenario applies to all 5 questions. The nurse is caring for a 30-year-old client who presented to the emergency room with complaints of muscle weakness that started on bilateral feet and has spread to the lower legs with burning pain. The client recently recovered from an upper respiratory infection 1 week ago, but still has a dry cough. The client is unable to move both legs. Knee-jerk reflex is absent. Bilateral upper extremity strength is equal and strong. Client denied bladder or bowel incontinence. Lung sounds are clear and no shortness of breath is reported. Vital signs are temperature 99.5 Fahrenheit or 37.5 Celsius, pulse 94, respiratory rate 18, BP 143/91, oxygen saturation is 98% on room air. Question number 1. Based on the presentation and assessment, the client is concerned for which of the following conditions? A. Amyotrophic lateral sclerosis. B. Myasthenia gravis. C. Guillain-Barré syndrome. D. Multiple sclerosis. The correct answer is C. GBS. All of these neuromuscular disorders involve muscle weakness, but they have unique differences. For example, patients with GBS usually present with ascending muscle weakness, in which the weakness starts in the toes or fingers and spreads upward, which is what the client in the question is experiencing. Myasthenia gravis is also manifested by muscle weakness, but it fluctuates and gets worse with activities. Multiple sclerosis affects the central nervous system and is more involved with altered sensation and balance and coordination. ALS also presents with muscle weakness, but it comes with cramping and twitching, also called fasciculation. Question number 2. Recognizing the client is at risk for GBS, the nurse understands the priority assessment is A. Risk for falls. B. Risk for altered mental status. C. Risk for respiratory compromise. D. Risk for cardiac arrhythmias. As with all neuromuscular disorders, risk for respiratory compromise is always the priority when the disease affects the respiratory muscles and the head and neck muscle that controls swallowing, which puts patients at risk for aspiration. About 30% of GBS patients require mechanical ventilation, and a test called negative inspiratory force is done to determine the risk for respiratory compromise in GBS patients. Respiratory muscle weakness can also happen in myasthenia gravis exacerbation and is referred to as myasthenic crisis, and in ALS, respiratory failure typically occurs in the later stage of the disease as it progresses. Question number 3. The client is now diagnosed with GBS. The nurse expects which of the following interventions? Select all that apply. A. Negative inspiratory force. B. Pulmonary function tests. C. Administer corticosteroids. D. Administer intravenous immunoglobulin. E. Administer disease-modifying treatments. The correct answers are A. Negative inspiratory force, which we already discussed, and D. Administer IVIG. IVIG and plasma exchange are both standard treatments for GBS, while disease-modifying treatments are indicated for multiple sclerosis. Steroids are both used to suppress the immune system in multiple sclerosis and myasthenia gravis, but have limited indications for GBS. Pulmonary function tests are not routine interventions for GBS. Question number 4. The nurse is preparing the client with GBS for intravenous immunoglobulin, or IVIG. For each intervention, click to specify if the intervention is indicated or not indicated for the care of the client. Assess client for iodine allergy. Verify client has a central line. Premedicate with acetaminophen and Benadryl. Implement NPO status. Educate client to report headaches, dyspnea, or urticaria. IVIG are indicated for a lot of autoimmune disorders. Similar to blood transfusion, IVIG is a plasma-based infusion therapy that delivers healthy antibodies from donated blood to patients intravenously. It is a weight-based dose that is given over a period of 5 days for GBS. Just like blood transfusion, there could be transfusion reactions like hypotension, headache, nausea, rash, and acute kidney failure. So we can say the interventions that are indicated for IVIG would be pre-medicate with acetaminophen and Benadryl to prevent reactions and educate the client to report hypersensitivity reactions, such as headaches, dyspnea, or urticaria, which is a fancy word for hives. We are not using any contrast in IVIG, so assessing for iodine allergy is not indicated. IVIG can be transfused via a peripheral line, preferably a larger gauge but does not need a central line, and patients do not need to be NPO for IVIG. Question number 5. The nurse is providing education to the client with GBS. Which statement made by the nurse is correct? A. GBS damages the protective sheath that covers nerve fibers in the central nervous system. B. Avoid heat exposure as it can worsen symptoms. C. GBS is associated with recent viral infection, smoking, and vitamin D deficiency. D. GBS is usually a single attack and does not relapse. Okay, let's go through each answer choice and see which one is correct about GBS. We know GBS damages the protective sheath that covers the nerve fibers, which is also referred to as demyelination. However, GBS causes demyelination in the peripheral nervous system, while multiple sclerosis causes demyelination in the central nervous system. So choice A is incorrect. GBS is not affected by heat exposure. Multiple sclerosis, on the other hand, can exacerbate when patients are exposed to heat, such as hot weather or taking hot baths. The most common risk factors for GBS are recent respiratory or GI infection while smoking, and vitamin D deficiency is associated more with multiple sclerosis, so choices B and C are both incorrect. That leaves us with choice D, which is correct, as GBS is usually a single occurrence, while multiple sclerosis and myasthenia gravis both have periods of relapse and remission. Thank you for reviewing the questions with me. See you next time.